Sleep. Without the proper amount of rest and sleep, the client's ability to concentrate, make judgments, promote healing, and participate in daily activity decreases. Ongoing studies are constantly changing the recommendations for the appropriate amounts of sleep for each age group. While caring for clients, you need to individualize an approach to sleep and rest based on the client's personal sleep habits and pattern of sleep in order to provide effective sleep therapies. Excuse me. The circadian rhythm is why we need to pay attention to the client's work, school, and life patterns and be aware how they are affected when they're hospitalized. Changes in routines, the amount of sleep or times awakened during sleep cycles, illness and pain can affect behavior while the client is awake. The biological clock will determine if you are a morning or a night person. The major sleep center is located in the hypothalamus, which secretes hypocretins that promote wakefulness and rapid eye movement sleep. Lighter sleep will occur in stage 1 and stage 2. Stages 3 and 4 will involve deeper sleep. Normally, a person is going to reach the rapid eye movement or the REM stage 90 minutes into the sleep cycle. 75 to 88% of the sleep cycle is spent in non-REM or non-rapid eye movement sleep. The amount of time that's spent in each stage of sleep will change as the client begins to age. During sleep, a person's heart rate can fall to 60 beats per minute, and it's pretty normal to see it that low. Sleep is important to the preservation of cardiac function, as well as to decrease respirations and blood pressure and to relax muscle tone. During sleep, the body will conserve energy and skeletal muscles will relax, and this helps maintain all aspects of our body function. Personalities can influence the quality of dreams. Most dreams are forgotten, but if you want to remember your dream, it's recommended that you consciously think about what you were dreaming of as soon as you wake up. Rapid eye movement dreams are usually going to be more vivid and elaborate. There's some psychotherapy situations that utilize dream analysis as a part of their therapy. Respiratory disease such as COPD, chronic obstructive pulmonary disease, emphysema, asthma, allergies, or the common cold often interfere with sleep. Nocturia, or getting up and urinating during the night, disrupts the sleep pattern. Restless leg syndrome, or RLS, can occur before sleep onset and can interfere with sleep. And of course, hospitalizations can affect sleep patterns. Being in the strange bed, being awakened for vital signs or assessments or medications, etc. Other patients that are being very loud or they're confused. There's a terminology called ICU psychosis where it's always light on the unit. There's not much difference between day and night, and if these clients are in there for an extended period of time, we often see confusion developing because they don't have the right light and dark patterns. Different sleep disorders include insomnia, where the client experiences symptoms of chronically having difficulty falling asleep. Sleep apnea, which is a disorder that's characterized by the lack of airflow through the nose and the mouth for periods of 10 seconds or longer. There's 3 types of sleep apnea: central, obstructive, and mixed. The most common form is obstructive, which is also another way of saying snoring. CPAP is the most common treatment for sleep apnea. Narcolepsy is a dysfunction of mechanisms that regulate the sleep and waking states when the client uncontrollably falls asleep at inappropriate times. Excessive daytime sleepiness is the most common complaint of narcolepsy. Sleep deprivation is a problem that many clients experience as a result of dysomnia. The causes can include fever, difficulty breathing, pain, emotional stress, medications, and disturbances in the healthcare setting. Due to long work schedules and rotations, healthcare providers are prone to sleep deprivation. Hospitalization can make clients prone to sleep deprivation also because of environmental noises and interruptions of sleep for care. And parasomnias. These are sleep problems that are more common in children and include things like sleepwalking, night terrors, nightmares, bedwetting, body rocking, and tooth grinding. Rest contributes to mental relaxation, freedom from anxiety, the state of mental, physical, and spiritual activity. When clients are rested, they experience feelings of rejuvenation, feeling refreshed and able to carry out their ADLs. Activities might include reading, relaxation, exercises, light exercises, music, long walks, sitting quietly. In other words, rest doesn't necessarily mean that you have to be sleeping. So resting can include those activities I just listed. It is important to allow clients periods of rest when you're caring for them. And it's important for nurses to be client advocates, looking out for the client's best interest. And you may need to encourage the client to rest and limit visitors or activity if the client is not getting sufficient rest. This is a chart that shows the normal sleep requirements and patterns for the different developmental ages. And another chart that shows different factors that can affect sleep. So let's look at the nursing process in regards to sleep. When you're doing an assessment, you need to get that sleep assessment. What is their normal sleep history, their usual sleep pattern, physical, psychological illnesses that may interfere with their sleep, current life events that may interfere with their sleep, their emotional and mental status, their normal bedtime routines, and we try and follow those as much as possible to help facilitate them falling asleep. As their normal bedtime environment, try and emulate that as much as possible. And do they have any patterns of sleep deprivation? Their diagnosis can also be very important in help determining their sleep process and helping to begin to develop the goals and the plan of the nursing process. So when you're planning, again, you need to help clients develop behaviors that are conducive to rest and relaxation. Bedtime routines need to be established. Clients should be safe from harm, comfortable, and free from stress. So some different things that you can attempt to help improve sleep. Bedtime snacks such as milk and cocoa can help promote sleep, while alcohol and caffeine can keep a client from sleep. You should also encourage the client to avoid heavy meals prior to going to bed, and the snacks that you're encouraging should be carbohydrates. The use of pharmaceuticals or over-the-counter medications can cause problems with extended use, and these should be used as a last resort only. Encourage relaxation exercises, avoiding television in the bedroom, avoiding hot showers or baths prior to bed, eliminating naps, or if you cannot eliminate the nap, then limiting them to 20 minutes or less, no more than 2 times a day. Physical activity can promote better rest. Keeping the bedroom for sleep and not using it for other activities. Comfortable room temperatures. Eliminating noises or using white noises to help induce sleep. Having an appropriate mattress and plenty of pillows. Infants and older adults will actually sleep better if they have a soft light in the room. Again, developing bedtime routines, different relaxation activities, avoiding mental stimulation prior to bed. If the client is unable to sleep after 15 to 30 minutes, encourage them to get out of bed, not to just continue laying there. Increasing bright light exposure during the daytime. Analgesics is needed if they're suffering pain, they're not going to rest very well. And decreasing fluids prior to going to bed. And how do you evaluate how they've slept? Mostly it's going to be through verbalization. They can complete sleep logs. They can compare sleep patterns with baseline data. And you can ask them some questions. Are you able to fall asleep within 20 minutes of going to bed? How well do you sleep when you exercise? Does quiet music help you relax? Do you feel rested when you awaken? Are some examples of questions that can help evaluate just how well the client has slept or rested.